A histological section of the articular surfaces, the upper and the lower, showing the upper temporal bone lined by fibrocartilage layer and compact bone in the mandibular fossa with more cancellous bone towards the articular eminence anteriorly. We see the disc of the joint, which is made of dense fibrous connective tissue, attached from the posterior, the right side posteriorly, to the capsule of the disc. We go down to the mandibular condyle, where it is lined also by fibrocartilage. Overlying the compact bone and the cancellous bone. We can hardly see the cavities, superior and inferior cavities around the disc. Anteriorly, you see attachment of the lateral pterygoid muscle head. Histological section of the lower compartment of the joint, showing the articular disc connective tissue and the articular surface of the condyle made of fibrous tissue. In the adults, this fibrous layer is made of fibroblasts and fibrocytes, collagen, and elastin fibers. Next is the proliferative zone in child, or a cell-rich zone in adults, which is made of undifferentiated cells. And mesenchyme, which replenish the cells in the upper and lower layers. Next is the calcified cartilage, which stays until 20 years of age as an ossification center in the condyle, for the growth of the condyle. Beneath is the bone, the subarticular bone, which is a thin, compact trabeculae of bone. This is the upper compartment of the joint. Above the articular disc and the cavity, or the TMJ space, we find the fibrous articular surface layer, followed by the proliferative zone, the fibrocartilaginous zone, made up of cartilage-like cells, the proliferative zone, where we see abundant cells, and the articulous fibrous surface made up of collagen, mostly of collagen type 1 fibers that are parallel on the surface and more vertical or perpendicular in the deeper zone. Okay, so I repeated the 3 layers of the articular surface overlying the mandibular fossa. It's called the glenoid fossa, or the articular eminence that overlies the temporal bone.